Okay, as you may know, America leads the entire world in drug addiction. This just came out on CNBC. Americans are hoarding a massive black market supply of opioids. Why am I not surprised? So, your biggest black market buyer of opioids are Americans. What happened the last time you were prescribed an opioid? If you're like most people, you didn't finish them and you didn't dispose of them. In effect, you are a potential source of illicit drugs and addiction that has been exploding across America. This rogue supply of painkiller is alarming, given the latest data on addiction deaths. Even after years of heightening attention from politicians and the press to the nationwide opioid plague, in 2016 saw an increase in overdose deaths of 21%, with rates of synthetic opioids death doubling. According to the Centers for Disease Control and Prevention, there are around 200 million opioid scripts a year. It's an extraordinary reserve, says Kenneth Humphrey, a professor of psychiatry and behavior science at Stanford University, who worked on drug policy for the Obama administration. That's just as many scripts as there are adults. It's such a huge reservoir to tap. Lots of people just don't think about it, Humphrey said. As many as 92% of patients don't finish their painkiller, and less than 10% dispose of them properly, either flushing them down the toilet or returning them to a hospital pharmacy or law enforcement. I never thought about giving my opioids. Now, when I had them, the remaining ones that I had, I just flushed down the toilet. If I call law enforcement, are you kidding me? I'm calling them psychotic. Get out of here. According to a new study published in the Journal of JAMA Surgery, for almost every injury we look at, patients had pills they didn't use, said Johns Hopkins pain management specialist Mark Bickett, who led the study. They become a source of illicit use. Other adults use them, and children and adolescents can find them when they're exploring, he said. At least two-thirds of a total of 810 patients didn't use their entire opioid prescription, but kept the unused pills, according to the data John Hopkins studies. And roughly 75% of patients ignored warnings to keep opioids in a locked cabinet. If it was only one or two pills, it would be one thing, Bickett said. But most patients have more than 10, almost the entire prescription, just lying around. He said many patients hoard the drugs, not not to get high, but so they can react to a relapse of pain or some new injury without seeing a doctor again. Many patients stop taking pills because their pain has receded, according to between 42% and 71% of those studied. A smaller group of patients stop taking the pills because of side effects. Either way, leaving the pills around the home leads to abuse. Some teenage kids want to experiment, but a teenager can also be entrepreneurial, Humphrey says. You know what? That's one thing I never did. I never went in my parents' pill bottles and took their pills. Hell, I barely wanted to take a damn aspirin. But that was one thing I never did as a teenager. Oh, please, a kid, these people will do anything to be high. You can sell 20 milligrams of OxyContin pill for $20 on the street. He added that other threats are beyond a family's ability to foresee. There have been cases where visitors to a real estate open house clean out pill cabinets. Oh my goodness. So when people are going around looking at a house that's up for sale, these junkies are going in people's pill cabinets and stealing their drugs. Wow. That's the one thing I never thought about until now. Now, I know they rob pharmacies. I know, people are stealing from hospitals, veterinarian offices. I never thought about someone looking at your house for sale and stealing your drugs. Wow. Woo, there's no level they won't stoop to, ladies and gentlemen. Opioids account for 2 million people with a substance abuse problem, according to the American Association Society of Addiction Medicine. Most people with opioid problems began by using pills. They were prescribed as pain relievers, but more recent twists in the plague include the resurgence of heroin addiction and abuse of fentanyl. The drug that's, oh, forget it, I'm getting out of there. Overdose in 2016 killed more than 64,000 Americans, with the largest number coming from people who abuse prescription pills such as oxycodone and hydrocodone, who brand names versions are OxyContin and Vicodin. More recently, the growth in overdose deaths have come mostly from fentanyl and heroin. The CDC data shows. Give away your painkillers to the right people. The simplest thing patients can do to dispose of prescription drugs properly is to simply flush them down the toilet. That's what I did with mine, Bickett said. Patients are right to fear doing environmental damage by flushing. The Drug Enforcement Administration has stated it can affect the water supply, but it's still a better option than leaving unused pills around the house. It's a trade off risk, Humphrey said. I think the candid answer a DEA official would give you is that flushing down the toilet isn't good because it's not good to throw toxic chemicals into the water supply. But flushing, although bad, is less bad than hoarding. Okay, let me just go down a little more. Initially, focus on law enforcement location of drop off. The Obama administration expanded the program late in 2014, giving pharmacies, hospitals, clinics, and other authorized collectors the ability to take back drugs. CVS, among other companies, now offer customers the ability to drop off unused prescriptions. Patients and their family members can also mail their prescription controlled substances to an authorized collector using prepaid mail back packages that can be obtained at a pharmacy or from other locations like libraries and community centers. If drop off is not an option, the DEA recommends preparing unused drugs for disposal by mixing with coffee grounds or use cat litter, sealing them, and throwing them in the garbage. Humphrey said these efforts work to a point. All right. So, coffee grounds and kitty litter. All right, let me just go down a little further. The Johns Hopkins study doesn't limit culpability to patients. Analyzing data from 6 previous opioid studies, Bickett found that doctors are failing to keep tabs on where all those pills go. Surgeons may not be aware of the magnitude of the problem, Bickett said. Doctors and patients are changing how they work with opioids, but need to do more. The simplest solution is not to prescribe addictive painkillers. Over the counter painkillers like Tylenol and Advil can be more effective than many patients think, especially when used with tandem, Bickett said. Alternating between the two can enable a patient to take more with low risk of toxic reaction than if the same patient use more than the recommended dosage of either one. So, ladies and gentlemen, what they're really ultimately saying is these unused pills are ending up on the black market, and Americans are the biggest buyer of those pills on the black market. That's pretty much to sum it up in a nutshell, because this nation is, where the biggest junkies are on the entire planet. Sad to say, but it's true. Please leave your comment and subscribe. And if you can donate to my channel, please do. And I will leave the link to this article in the description box. Peace, family.